policies to improve health insurance coverage as America recovers from COVID 19. The American Rescue Plan expands health coverage and affordability for millions of people as the country climbs out of the coronavirus crisis. This issue brief contain a correction. 1 year ago this month, the first wave of COVID 19 cases in the United States led to the widespread jobless job loss throughout the country. Early in the pandemic, there was serious concern that the impact of these job losses would lead millions of workers to lose job based health insurance coverage, causing a dramatic spike in the uninsurance. Evidence to date suggests that the number of uninsured people has not risen as greatly as initially feared. Although the number of jobs in the United States remain about 9.5 million below pre-pandemic level. Workers in the industries that were most affected by the pandemic's economic damage tended not to have job based coverage to begin with. Some of the estimated 3 million people who lost job based coverage in 2020 gained other form of coverage through public programs include Medicaid and the Children's Health Insurance Program, and through the health insurance marketplaces established by the Affordable Act. High total coverage losses were not as great as projected last spring. Federal action is needed to fill coverage gaps for the tens of millions of uninsured Americans and improve protection against medical costs for families facing the financial strain of the pandemic. This issue brief describe the extent of coverage loss during the COVID-19 pandemic, outlines the evidence for why the uninsured populations did not increase as dramatically as expected, and explain how the American Rescue Plan, the stimulus bill that President Joe Biden is expected to sign this week, will elevate uninsurance and underinsurance as the United States climbs out of the coronavirus crisis. How coverage changed during the pandemic. After the passage of this ACA in 2010 to 20 million Americans gained insurance coverage. The largest increase in coverage was in 2014 when the provisions of the law expanding Medicaid and opening the health insurance marketplaces went into full effect.